Raylyn, and I will be performing my sterile dressing change skills video for my sterile technique. My supplies for this video are my Nightingale scrubs from head to toe, my Nightingale badge, my trash can with my biohazard bag in it, my wound that already has a bandage over it, which will be the dirty dressing that we'll be changing. I'll have our gloves, and then I have my sterile dressing change kit. For this procedure, I'd like to show that I have no nails, no jewelry, nothing on, because this is a sterile video and procedure. I've tried to pick a spot where I can move freely. However, I may need to move things to stay in range, but in the real world, you would not be touching anything because this is a sterile procedure. The first thing that I will do is walk into my patient's room. I will introduce myself. Hello, Mr. Smith. My name is Raylyn. I'm your nurse today. Can you verify your name and your date of birth? I will then allow the patient to verify their name and date of birth by checking their wristband for 2 patient identifiers. I will also close the curtain or the door to ensure patient privacy. I will then explain what we're going to be doing today. Mr. Smith, I'm going to be changing out your dressing, putting a new one on. Are you okay with that? Mr. Smith has consented to the procedure. I will then wash my hands and perform hand hygiene. So I have washed my hands. Now I'm ready to change the dressing. So I will put on my gloves. So I will be removing Mr. Smith's dressing now, and you want to remove it parallel to the wound. So, and then we will discard of that. Next, I will take off my gloves and also discard of those. Toss them there. So I will now perform hand hygiene. Once again, before I open my sterile kit. Hand hygiene has now been performed. I am going to kind of move this down so that you can see everything in the video. Again, in the real world, you would not be touching anything, but I need to stay in frame for you to see what I'm doing. I will then open my sterile kit. This is still sterile, so in the real world, it would not be open, and you would make sure that it's completely sealed and not tampered with. I will then open it with a 1-inch border. You cannot touch anything on the inside because it is sterile and you don't want to be reaching over it. So this is open so that it doesn't keep flapping closed. I will then carefully remove just the gloves, and I will be placing it on a flat surface. This is also sterile, so you only want to touch the 1-inch outside border. Next, I will be putting my sterile gloves on. So you take your 2 fingers like we did with our sterile video and put gloves on. Make sure they don't roll. Next, I'll take my 4 fingers and put them on like this and maneuver my other glove on. Now I have my sterile gloves on, and I'll be moving back over to this. This is still a sterile procedure, so you don't want to be going over everything with your gloves and keep them in sight in this. So now that this is clean, now that the bandage is off, I will clean it. So I'm going to take my applicator. We only have one. I will drop it in this hand, and I will clean the wound from the inside of the wound to the outside of the wound. Okay, inside to out, drop that in there. Next, I will take my gauze, drop it in my hand, and I will again now clean and dab the wound from inside to outside and get it all nice and dry. again, plop that in there. Now that the wound is clean and visible, you'll want to go ahead and assess it before putting on your transparent dressing. So I will palpate the wound, make sure that there's no pain for the patient, no discharge, no discoloration, no damage to the tissue integrity, and it looks good. Nothing has been noted. You'd also measure the wound if directed to, if there's orders to. So all of that has been done. Next, I will be taking my dressing, and I will use both hands now to peel the dressing. And I will plop this in there, and we want to put it right over the wound, nice and neat. And then you want to take off this border. So take off the border of the dressing, and you will throw that away. Now that the dressing has been changed, that procedure is done, you will want to take your sterile kit, throw it away in biohazard, and you will want to remove your gloves. Throw that away as well. I will now perform my hand hygiene. Mr. Smith, are you comfortable? Good. And do you have any questions? Good. I made sure my patient is comfortable, has no questions for me. Now I will go document and chart my procedure.